Hey mamas, it's your CajunStork here. Today we're going to talk about 2 midwife recommended tips to reduce round ligament pain in pregnancy. But before I begin, my name is Midwife Kira and I believe in truly natural birth because I know that it makes for better birth experiences. Consider subscribing to my channel and don't forget to join us every Midwife Monday for a new video. And if you look in the description below, you're going to get a link to my pregnancy complaint kits that I designed with natural remedies for my own clients that'll help benefit you in your pregnancy. So what we're seeing here on this little diagram is a 9-month pregnant mama. And the reason why I know that is because this right here, being her uterus, extends all the way up here to her breastbone. You guys see that right here? Now, just to kind of give you a little basic anatomy before we jump in, obviously this is the uterus, as I just said. We have the bladder right here, the vagina right here, and the rectum right here. Going into right here would be the spine. So what we're looking at here is the outer part of the uterus with the ligaments. These are the broad ligaments and the round ligaments. This right here is the broad ligament, which we're going to talk only a tiny bit about. I really want to get into the round ligament. This broad ligament, I want you to picture like a cape coming over me if I were the uterus and the ovaries. And this cape would come over me and connect the uterus to the back of the body to kind of keep it suspended. So this broad ligament right here is impacted in a variety of ways in pregnancy, but thankfully you're not going to feel too many spasms or things like that from that. This is really where a chiropractor can come in and assist you best with this. What you will feel when you're pregnant, if you haven't yet, it's only a matter of time, is this right here, this round ligament. Now your round ligament in pregnancy tends to spasm. This is a normal response of being pregnant. Whether it's your first time being pregnant or your 15th time being pregnant, this round ligament is going to cause you some kind of grief in your pregnancy at some point. Typically, clients complain about round ligament pain when they get up too quickly, they're switching positions too fast, they're walking too much or overdoing it physically, or sometimes even after having an orgasm in sex, this round ligament can cause spasms from that contraction of that uterus. No matter the case, you can see very clearly right here why this round ligament is going to cause you grief in your pregnancy. You can see how just tightly stretched this ligament is, and as that uterus grows, this ligament grows up with it. And where does it attach? All the way down here near your pubic bone. So although symphysis pubic dysfunction could be a concern, a lot of times lightning crotch is another way to describe round ligament pain. They're sharp, spasmy pains that you're going to feel down below. Now, these pains shouldn't last very long. It should be just a couple of seconds. If you find yourself in pain for hours, you definitely need to contact a healthcare provider because that could be other things. But round ligament pain is a normal part of pregnancy. I want to give you 2 midwife tips on how to make this easier on you. First of all, the number 1 tip is I want you guys to get into a deep-seated squat when you're pregnant. What does this have to do with your round ligament, you might ask? So there's a lot of information on the internet that squats are beneficial to pregnancy and to your birth. Right, no problem. But what most of my mamas don't realize is it's not the numerical amount of squats that's beneficial in pregnancy. It is the ability to sit and maintain a deep-seated squat when you're pregnant, similar to how you would do in prenatal yoga. These deep-seated squats not only stretch out that pelvic floor, which obviously you need for your birth, but also the glute muscles or your hiney muscles, another way to look at it. And by stretching out those glute muscles and those pelvic floor muscles, you can prevent spasms from occurring in that round ligament. So the easiest way to do these deep-seated squats is to be able to get both feet flat on the floor, drop yourself into a very deep-seated squat. You know you're in the right position if you can physically Kegel when you're in that squat. If you can't, adjust your feet, get yourself replanted, and do it again. You can play with your kids on the floor in your deep-seated squat, watch TV, fold laundry. There's no actual amount of time, but typically in your 3rd trimester, I would recommend that you maintain a deep-seated squat at least 2 minutes a day if you can. Now, if you're really late in your 3rd trimester when you're watching this video, it's very unrealistic, especially with your large belly, that you're going to be able to maintain that deep squat. So do your best just to get as much time as you can. But your ability to maintain that deep squat is not only going to prevent round ligament spasms, it's also going to help you have an easier, faster birth. And who doesn't want that, right? Now, number 2, and my favorite midwife tip, the easiest midwife tip that I can give you to relieve round ligament pain is inversions. An inversion, which I'm going to show you in just a second, is simply just taking your body and inverting it against gravity with your hiney up and your chest down. Or if we're looking at this model here, the easiest thing to do would be to prop your feet up onto your knees, really, up onto a couch, a chair, a table. Make sure you have help if you're in your 3rd trimester, because obviously you're probably pretty wobbly with this brand new belly. But to get yourself into an inversion where your hiney is up and your chest is down, you are actually using gravity to stretch this round ligament muscle, this round ligament right here, and that can actually prevent spasms. The benefit of inversions, it's only like 30 to 60 seconds, 1 to 2 times a day, you guys. That's all it takes to prevent round ligament spasms and also to help reverse them if you're already experiencing them by the time you've watched this video. Inversions are awesome. I recommend them to all my clients. And before you ask, it will not turn your baby breech. Inversions are a very normal and safe thing to do when you're pregnant unless you have hypertension, in which case you want to talk to your healthcare provider. So, inversions, deep-seated squats, doing both of them is your best chance at success in relieving those round ligament pains. So now you have some midwife tips on how to make yourself feel better when you're pregnant. If you guys need any more information, go ahead and leave me a comment in the comments below. Otherwise, I'll see you next Midwife Monday. Thanks for watching. Bye-bye.